This presentation will analyze the northeast area of St. Petersburg, the structure of the community, as well as the issues the community deals with as a whole.
The boundaries for this community begin with 14th Avenue North to 16th Street North to 62nd Avenue North to Tampa Bay. Their zip codes 33703 and 33704. St. Petersburg came about in 1875 when General John Williams traveled from Detroit and purchased 2,500 acres of land. However, the city was not named St. Petersburg until 13 years later when Williams transferred part of his land to a Russian aristocrat named Peter Demens. Peter Demens named the city after his hometown, St. Petersburg, in Russia. With the development of the Gandy Bridge in 1920 comes the rise of the well-known architecture and neighborhoods. The Vinoy, the Princess Martha, Snell Isle, and Coffee Pot Bayou. More development in the 1960s brought Bayfront Medical Center, the main library, and the municipal marina. Now in the 1990s, St. Petersburg begins its journey in the Major League Baseball industry with the Tampa Bay Devil Rays playing in the famous Tropicana Field. St. Petersburg to this day continues to develop and affect tourism with its beautiful waterfront parks, resorts, and beaches.
The community structurally meets the needs of its members with many single-family homes and apartment complexes, old and new developments, and well-maintained lawns. Most of the houses have driveways and the streets are wide and clean. This can also be seen in the surrounding communities as well. There are not many sidewalks, making it dangerous for kids to ride their bikes and play. The concerns for the communities are a lack of crosswalks, sidewalks, and bike lanes, putting pedestrians at a high risk for injury. In the 2013 census, the population for the community was 249,688. During November through February, the population increases throughout the year within a season of snowbirds. Caucasian people, 68% of the population, Hispanic 6.6%, and African American 23.9%. The remaining ethnic groups 6.1%. There are a lot of businesses and companies that help the economy. 38% of the people in the community graduated with college degrees. The largest health concern within the community as well as the county is heart disease. Heart disease make up of 23.9%. It compares to Hillsborough County, with heart disease also being the leading cause of death at 28.4%.
The community is home to many urgent care clinics, easily accessible on 4th Street, along with hospitals, nursing homes, and home health agencies just outside the community. Prices for these company services depend on the patient's insurance and services rendered. Goals for the community are to provide free immunizations to everyone by 2018, develop a mental health facility by 2020, and increase incentives for people of the community to join local gyms by 2016. Not only are vaccines the most effective preventative service available, they decrease the rate of infections and save countless lives. There is a large number of people with mental illness within the community and in the surrounding communities as well. Mental health disorders are a growing problem and are said to be the leading cause of disability within the United States. The current gyms provide small discounts for short periods of the year, but nothing felt to be substantial enough to entice more people of the community to get out and get in better shape. Healthy People 2020 stated in 2015 that early physical activity could help prevent high blood pressure, coronary artery disease, type 2 diabetes, and even stroke.
Tampa Bay provides an adequate water supply for the city of St. Petersburg. The water is purchased and delivered to the city's treatment and distribution plant. All citizens have adequate access to recycling through curbside or drop-off programs for recyclable items, making recycling convenient. Duke Energy provides all of St. Petersburg energy needs. They provide adequate energy for the city, but many of the community members are unhappy with the continuous rise in rates and fees. They are currently the only energy provider in Pinellas County.
The community has a great economic standing in St. Petersburg with busy restaurants, grocery stores, bars, sporting goods stores, and automotive shops to name a few. Mayor Rick Kreisman and the city council members are somewhat accessible to the public through city council meetings and agendas. Within the meetings, residents can speak with representatives if they have concerns regarding plans for the community. The homeless population is an area of concern in the community, and in Pinellas County there are over 4,000 homeless people. Opening Doors of Opportunity is a plan that was developed to end homelessness in Pinellas County. Listed are the 4 goals the city identifies as important regarding the homeless. 6 community needs consist of education improvement, decreasing the homeless population, community development, health promotion, elder care, and economic development. Fortunately, these needs are being addressed. The community needs more after-school programs for children promoting education and providing tutors because children are a good foundation to prevent or improve the other community needs listed. The Our Club Child Care is a facility located in the community which provides these services, but is the only facility within the community. The community health nurse can provide education to children attending these after-school programs on things such as hygiene and basic safety. The homeless population is the second highest priority due to the fact that it is a growing problem within the community. The Salvation Army provides a place to sleep for the homeless, but beds are limited. The community health nurse has an opportunity to provide education to the homeless at these venues regarding safety and drug treatment programs.
The community is in need to develop more recreational centers for the youth. The city of St. Petersburg also has plans to continue the investment of funds into street improvements for the communities and construction of new sidewalks. The community health nurse would see this as a priority for the guidance of safety of children. Health promotion is also a priority need for this community. Being that the community and county as a whole have a high rate of heart disease, education needs to be provided whenever possible to inform people how to lower the risk of heart disease. Immunizations are another form of health promotion that the community is addressing. Immunizations are given for free or at discounted rates for qualifying individuals. The community health nurse has the opportunity to provide education on heart disease and the importance of getting vaccinated to a large number of people because they are the ones working in every area of the community.
Retirement rates are on the rise in the community, and managing care of senior citizens is important for the aging population. The community is in need of more assisted living facilities, senior transportation, senior citizen social activities, and home health care. The community health nurse can also provide services to this demographic by providing home care and education regarding safety and nutrition. Lastly, economic development enhances access to new resources to pave the way for a thriving economy. The Planning and Economic Development Department in St. Petersburg offers individual business development assistance as well as numerous programs designed to enhance the viability of local businesses, including encouragement of business growth within the city. Immunizations are a desirable form of primary prevention and health promotion across the globe. In other countries such as Canada and the United Kingdom, vaccinations are already provided for free. Studies have shown that in 1 year of people receiving the influenza vaccine, there was a reduction of 71% of flu-related hospitalizations within adults. The community is in need for free access to immunizations. Immunizations are provided at local clinics and doctors' offices, but they are not free. The city of St. Petersburg does have discounted and free rates for some qualifying individuals, but not for everyone. I believe if immunizations were free for everyone, it would provide more of an incentive to get vaccinated and the infection rates would decrease dramatically. Community health nurse could hold vaccination events annually within the community, encouraging children and adults to get vaccinated for free. The vaccinations could be paid for using part of the city's budget along with governmental grants.